The identification of people with familial hypercholesterolemia is hugely important, and there are several reasons for that. First of all, as the name says, is a genetic disease that is present in the family and is transmitted in the family by generation to generation. Having said that, that means that when you have identified one person in the family affected by this disease, the likelihood to detect other people is quite high. So this is so named a sort of cascade screening. But the real reason for detecting and the relevance of detecting familial hypercholesterolemia is that this is not the usual form of hypercholesterolemia. People affected by this genetic disease have high level of LDL cholesterol since birth. And so the cumulative area of exposure to cholesterol or the arteries of the people affected by familial hypercholesterolemia is way higher than what occurs in people who develop hypercholesterolemia later in life. And this is why these subjects do have a very high risk of developing cardiovascular disease. Very few patients are identified, with a few exceptions, selected countries having familial hypercholesterolemia. There are a couple of reasons for that, and both of them are related to the lack of awareness by physician and population of the condition. Many physicians have a misconception about FH. They think it's a simple hypercholesterolemia, which is not. Those subjects are at much higher risk due to the fact that they have had high cholesterol throughout life. The second point is having this belief they will treat the subject as they will do with other people having high cholesterol. So they will calculate the global risk according to the guidelines, which is a mistake. They shouldn't do that, because having had high cholesterol since birth puts you at a very high risk. So people with familial hypercholesterolemia stand apart from the normal hypercholesterolemia. You shouldn't calculate the risk, but you should go directly to therapy because it's a very high risk condition. To help physicians to detect familial hypercholesterolemia, our society, the European Atherosclerosis Society, has endorsed a scoring system that will allow physicians in 3 minutes really to detect possible familial hypercholesterolemia subjects. This tool is very simple and relies on one biochemical measurement, that is LDL cholesterol, and then the discussion and visit of the patient by the physician. There are some points that are the pillars of this scoring, that is family history of cardiovascular disease, history of cardiovascular disease in the subject, the patient, and finally the presence of xanthelasms, xanthomata in the patient itself. Putting together all this evidence, the physician will be able to sum up the points, and anything that is above 6 should make him suspicious of FH and should prompt him either to go into the therapy or to consult with a specialist in lipidology in order to confirm the diagnosis.